Good afternoon and welcome to the 202nd of the COVID calls. This is a daily discussion of the COVID 19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today, we continue the congressional COVID calls with my guest, Pennsylvania Senator Bob Casey. Just a reminder, you can catch COVID calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID calls YouTube channel to watch. You can also watch COVID calls on Facebook Live and on Periscope. You can hear COVID calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID calls via Twitter using the handle @US of Disaster or @COVID calls. Please do help spread the word and send suggestions for future guests and future topics. As of today, January 14th, 2021, there are 1,985,836 deaths globally from COVID-19, according to the Johns Hopkins University Coronavirus Resource Center. There are 23,194,318 cases in the United States. There are 386,577 deaths reported from COVID-19 in the United States. That's up from 383,113 reported yesterday, and 18,749 of those deaths have been in the state of Pennsylvania. At this point, I would usually read an obituary. Today, we're going to get right to the interview, and I'll read 3 obituaries from Pennsylvania COVID victims in the second half of COVID calls today. But I want to get right into the discussion with my guest, Senator Bob Casey. Let me just very briefly introduce him to you. United States Senator Bob Casey fights every day for Pennsylvania families. He's a strong advocate for policies that improve the health care and early learning of children and policies that will raise wages for the middle class. Senator Casey serves on 4 committees, including the Senate Finance Committee and Senate Health Committee. He's also the highest ranking Democrat on the Special Committee on Aging, where his agenda is focused on policies that support seniors and individuals with disabilities. Senator Casey and his wife, Teresa, live in Scranton and have 4 adult daughters. Senator Bob Casey, welcome to COVID Calls. Thanks for your time today, sir.
Doctor, great to be with you. Thank you.
I'd like to start the way I usually do, just find out where you're calling in from and what the pandemic situation is like there today.
I'm in Lackawanna County in Scranton, and like a lot of communities in our state, the case numbers have been high. We seem to be leveling off a little bit, but it's been particularly high these last couple of months, as it has been throughout the Commonwealth.
I wonder if you could tell us a little bit, just as we start out, about your experience of January 6th. I mean, we seem to be making history almost every day in this pandemic. January 6th was quite a day. Can you talk to us a little bit about it?
Yeah, I was in the Senate chamber when the disturbance surfaced, and I, of course, being the optimist that I am, never thought that it would reach the point that it did. When I knew there was something wrong when the Vice President Pence, who's in the Senate, his role is president. He's called president of the Senate, and he presides, not all the time, it's rare, but on occasions where there's something substantial that's going to transpire, like the determination of electoral votes. But as Senator Lankford from Oklahoma was speaking, you could see a security official go to the rostrum and ask Vice President Pence to leave, kind of pulling him off the away from the presiding officer's chair. And he then had to be replaced by Senator Grassley, who's the president pro tempore. But when that happened, I knew something was wrong, and you could hear a little bit of noise, but not much. We couldn't hear gunfire or windows breaking or the like. But then within a matter of minutes, the Capitol Police kind of stopped the proceedings and urged us to stay away from the doors, stay at our desk, and they would lock down the chamber. But over the next, say, 20 minutes, the chamber was flooded with staff and Capitol Police and Secret Service, other personnel. So now a chamber that had a little more than 100 now probably had 200 people. I thought we would be there for a period of time and the disturbance would be quelled and we'd go back to work. But it wasn't soon after that that we were rushed out of the chamber. By this time, about 200 people going through just one door because all the other doors were locked and
Mm-hmm. Mm-hmm.
secured. What
Right.
I didn't know at the time, and I found out much later, like a lot of Americans, is that they were very close, very close from the chamber. Some coming to apparently take hostages and maybe trying to kill the vice president, if not kill others. So it was only afterwards that I realized the gravity of it, and it was just a terrible day for the Capitol and the people that work there, but really bad day for our country and for democracy. And there must be full accountability for this.
Well, what do you expect to happen next? I mean, you've already voted to impeach this president once. Is that where this is headed in the Senate, and when do you expect it to happen?
Well, we don't know precisely when the Senate trial will start, but we know this: the law requires that we have a trial. Once you have articles of impeachment that are delivered to the Senate, that compels us to have a trial. I don't think it should take that long. Maybe two. I hope it'll only be 2 days, probably three.
Mm-hmm.
But we would have to come to a determination in the Senate. Now that he has been impeached, we'd have to come to a determination about conviction or not based upon the evidence. I think the evidence already on the public record is substantial. You don't have to unearth a lot of new documents to make the case, but that process will potentially go beyond his term. So the question of removal would be moot, but the question of conviction would still be a determination by the Senate.
And one of the questions that's been asked a lot, and I'd like to get your perspective on it, with so much work for Congress to do in the new Congress and the new administration to fight this pandemic, any concern that there's a Trump hangover with this trial that has to, as you say, has to happen, and these votes that have to happen? How will the Senate be able to do both of those things?
Well, there's no question there'll be a hangover, but I think there's going to be a hangover from this president on a lot of fronts. He operated every day by one rule: divide. That was he literally believed that was in his best political interest, to keep the country divided and hostile. And he was very effective at keeping the country divided. So no matter what we do, there'll be somewhat of a hangover. But I do think people begin to turn the page. It may be difficult to turn the page maybe in the first few days if there is a trial, but we've got to do both. We've got to transact business in the morning, meaning trying to get confirmations done of cabinet officials and leading major agencies. And we have to do a lot of work to prepare for a COVID-19 and economic relief bill. And we have to conduct a trial. So the trial part of that, the impeachment trial part of that, would proceed in the afternoons and well into the evening. And I hope that we could, and there's no guarantee of this yet, but I hope we could have this play out, say Thursday, Friday, Saturday, and maybe by the next week concentrate on the new administration's work and the work we have ahead of us.
I want to talk just a little bit more about the year that we've had, and a question that's been very much on my mind is the connection between the pandemic and all of the tension and violence, in many cases unexpected, pushback in this country to public health measures. It's been a very rough year. It was a very rough year. What connection do you see between the pandemic and the violence that happened at the Capitol on January 6th? I'm sort of fascinated to find out, because it's very hard to differentiate the violence of this past year. It's hard to pull this pandemic away from the politics. I'm curious to know the way you see those connections.
Well, both the pandemic and the attack on the Capitol both have their origins in the president's conduct, the president's actions, and his ability to, or his focus on, obsession really, with dividing Americans. There's no question that in my judgment, his words and actions incited the mob that came to the Capitol. It's hard to comprehend how powerful his voice is with certain Americans, but I think that was most evident when you had people storming the Capitol, not only intending to kill or capture or injure members of Congress, but they said over and over again when they arrived, at least a large group of them, three words: hang Mike Pence. If a president, Republican president, can so incite a crowd to commit or try to commit an act of murder against his governing partner, a fellow Republican, a conservative Republican, you know the power and the toxicity that he brings to and has brought to our dialogue in America. So the same is true, unfortunately, with regard to the virus. Think of where we would be now. Those case numbers and death numbers that you read today, more than 18,740 deaths in Pennsylvania.
Right. Staggering.
Those numbers would be a lot lower, both in Pennsylvania and across the country. I am certain if the president way back in March, if not before that, was very clear with the American people, if he told the truth, like he told the truth to Bob Woodward when he thought no one was listening,
Right.
about the severity of the virus, the death and destruction that would result unless we could somehow tackle it. If he told the truth, if he modeled good behavior, if he didn't divide the country even on masks, we would be in a different place now. We wouldn't have this political divide on public health and on masks and the rest. So his ability to demonize and divide and frankly distract away from the priority of having the nation united to defeat the virus not only led to more deaths and more cases, but actually made the economic trauma worse. As long as the pandemic was extended, then the economic trauma was going to continue. So a lot of people were hurt by his failure to lead and his obsession with division rather than unity and consensus.
If we can go back to the earlier period of the pandemic, March particularly, and in April, first of all, I'd like to just know a little bit about your own experience, becoming aware of this pandemic and when you kind of realized the magnitude of it. And I want to ask that because it did seem there was a time there when there was, it's kind of ironic, there was a unity. We were all separate. We were all in our homes, those who could be. But there was a national unity of purpose in places around the country, and that dissolved pretty quickly. And so I'd like to sort of take you back to that earlier part of the pandemic. What were your thoughts at that time earlier on? And were you surprised that that unity kind of dissolved as quickly as it did as we went into the summer?
Yeah, again, I think it starts with the president. When you have a national pandemic that is raging around the world, beginning to rage around the world and affecting your own country, there's the leadership, the primacy of the presidency becomes indispensable to success, or the ability to somehow manage or mitigate the impact of the virus and the disease. So any consensus that dissolved, that dissolution was led by a president who just refused to embrace the truth and literally to lie about it over and over and over again, which I guess was a precursor to his lies about the election. Right. But you're right. At the beginning, there was a much greater consensus about what we had to do together. That by staying home, we could all do our part. But there's only so much you can do as a governmental leader or a business leader or a leader in a community if the person at the top is not only giving contrary messages.
Right.
On many days, he was just not telling the truth, but also kind of inconsistent messages. Even the public health messages were undermined by his failure either to enunciate them or his sometimes right on the same stage where one of the scientists or professionals would say something and he would try to reinterpret it or say it a different way so to make it sound not so bad. His obsession with the stock market should have been an obsession with tackling this virus.
Aside from and I agree with you, it must start there with the president. Aside from that, what were the other things that happened in the federal response that you were keeping an eye on there in the spring that we can learn from as we go into this second year of the pandemic? We're going to have to change the way that we react to disasters in the United States, whether or not the president is a disinformation artist, which that one is.
There's no question that we've got to reassess the public health infrastructure of the country and learn from this pandemic to better prepare for the next. Certainly with the pandemic all hazards legislation that's been in place over now more than 2 decades, or about 2 decades, we had some infrastructure in place, but not nearly enough.
Mm-hmm.
And I think we have to reassess, for example, the whole question of personal protective equipment, even the simplest or most rudimentary parts of that. If the United States of America, the most powerful country in the history of the world, the strongest economy in the world, the strongest production capacity of any other country, if we can't produce and then store enough personal protective equipment, gowns, masks, gloves, and then the more sophisticated ventilators or respirators, if we can't have that production scaled up, almost what I would argue is we need a whole new manufacturing sector to produce all that, and then to store them in temperature controlled or climate controlled conditions so they can be utilized not just 5 years from now, but many years from now. If we can't do all that, then we're not who we say we are. So I think that was a failure that predated even this president. And so I think there's also has to be a focus on local, even at the county level, public health infrastructure. We just failed to invest in counties and states, and even at the federal government level, in the kind of infrastructure we're going to need. So a lot of lessons to learn. I think that's to be reflected, I hope, in future collaboration and legislation.
Well, let me pick up on one issue that I know you've been very active on, and it's been startling, I think, to everyone that more than 40% of the deaths from the pandemic have been in long-term care, elder care facilities. You co-sponsored a bill with Senator Patrick Toomey in November. I'm just going to read just a sentence from the press release there, but in proposing it, you said we have an imperative to help nursing home residents and workers amid the public health crisis, and we must also improve care quality in nursing facilities, especially those that have a consistent pattern of failing safety and care standards. Why were nursing homes so vulnerable, Senator?
Well, I think in some ways we have to look at this from 2 vantage points. One, what would be the circumstance in long-term care facilities absent the pandemic?
Mm-hmm.
Unfortunately, that's not a very positive picture, because we have not invested enough, nor have we held nursing homes and long-term care facilities accountable enough, even absent the pandemic. So that's a whole other question, and Senator Toomey and I were trying to address that question in our legislation. But when you look at long-term care from the perspective of what went wrong in the pandemic, starting basically in the month of March, a couple things went wrong, and this affected poor performing facilities, but it also affected facilities that have never had a problem with their performance, have never been on the list where they get special scrutiny. Even high quality facilities were having trouble. And the problem was just the fundamentals: not enough personal protective equipment, not enough capacity to do testing. And it's a subset really of, it's not just a subset of the larger tragedy of the pandemic, but it's a subset of the failure to have a national testing strategy and to have enough testing capability in long-term care facilities. So what I suggested early on, and I put it into legislative form, was to dedicate new dollars for all of those priorities: testing, PPE, dollars for surge capacities, because sometimes what a nursing home needs in the midst of an outbreak is they need personnel. They need more docs or nurses or certified nurses assistants and others. They also need help with this so-called cohorting, where you separate the nursing home resident with COVID-19 from those that don't have it.
Mhm.
And of course, the kind of the concomitant problem here was you had staff who, first of all, do work that is they're poorly compensated for, and the high turnover rate leads to poor quality care generally. But then these same staff that we haven't invested in or valued in any fashion in society, they
Mhm.
were, because they're working and living in a community, coming back and forth,
Right.
sometimes contracting the virus in the facility and bringing it out, or contracting it in the community and bringing it into the facility. So all of these issues resulted in reports that I worked on with a few other senators. For example, I'm looking at one here.
Mhm.
This was a report from September, and just look at the top of it. The cost of inaction, 11 deaths an hour. This was just over like a 2-month period in the
Right.
summer of 2020. 11 deaths in nursing homes an hour. And as you mentioned, Doctor, the high number of deaths of nursing homes, when you add up resident deaths and worker deaths combined, they comprise, as you said, about 40%. So just a horrific nightmare within the larger tragedy. And we, I think, have to take steps even beyond the gravity of the period, I should say, of the virus, to address long-term care, because
Yeah.
it's still a challenge, even absent this terrible virus.
Well, let's do this for a minute because I think, I mean, your connection there to also the long-term care facilities as sites of work for essential workers. And we've learned, I mean, many communities didn't have to learn this in America, but I think a broader swath of Americans have learned a lot about inequality this year.
Yep.
Lessons we should have learned a long time ago. And so it seems to me your work on aging populations and on nursing homes is also a leverage point into a much needed conversation in America about vulnerable populations who happen to be in this pandemic, communities of color,
Yep.
that, and then also older Americans. And of course, it's impossible to disentangle the death of George Floyd, Breonna Taylor, Black Lives Matter movement from, I mean, it all gets together in one really important conversation. I wonder if I could draw you out on that a little bit, on those connections.
Yeah, we've used a very innocent sounding word, disparities. It almost sounds very technical, but I think we probably have a much better sense of what that word means today, because of the virus, and because of the horrific death of George Floyd, and, as you mentioned, Breonna Taylor and others who remind us not only of the obvious problems in policing, which have to be addressed, I think, and we have legislation to bring accountability to policing, which would be historic if we were to pass it, the Justice and Policing Act. But that's not enough. You could if that bill passed tomorrow morning, you would not be solving some of the underlying problems that result from these disparities. So another way to talk about disparities is injustices, or a series of injustices.
Mhm.
The injustice in housing, the injustice in healthcare access for communities of color, the injustice in education, the injustice even in the environment. Climate change isn't about some far off problem with the environment. Climate change directly affects communities of color right now, adversely. So when you go down the list of those disparities or injustices, in light of this terrible pandemic, I think the resolution of some of those problems, or the remedy for some of those disparities, becomes ever more urgent. We have a lot of work to do to make sure that we lift people up beyond where they were before the pandemic. That's why I think it was so appealing when
Mhm.
Joe Biden said, build back better. He didn't just say, build back to where we were. He said better. And better means we have to lift people up. And even in the context of healthcare and long-term care and the pandemic, we have to make sure that as part of an economic strategy that caregiving is lifted up and valued. We can't say we really care about seniors, no matter where they are in America, if the people that are providing most of the care, the direct care workers, taking care of seniors, taking care of people with disabilities, taking care of children, if they're paid $12 an hour or paid $10 an hour or $13 an hour, we have to lift up these professions and accord them the respect that not only they deserve, but accord them the respect that we say we place with regard to the value we claim to place on the lives of vulnerable Americans, whether they're in communities of color or whether they're seniors or kids or people with disabilities.
And it's very powerfully said. Thank you for that. And it shows us also that, as we were talking earlier about the failure of leadership, it's a much bigger story. And I don't think we can let ourselves off the hook by saying, well, we're done with President Trump, so that's all over now, because these injustices, I'm glad you used that word, are longstanding and they're structural in America.
No question about it.
I see this work you're doing with nursing homes as a way to directly confront that pretty aggressively. What's the forecast for that bill?
Well, I think the fact that Senator Toomey is supportive is significant because, as you know, in the Senate, getting a bipartisan dance partner, otherwise known as a co-sponsor, can be rather elusive. It's difficult. So I think we should be able to pass it. But I don't think that will be enough in this space. We have to do more. Part of this is dollars, and that's where you have real trouble getting consensus. But there are ways that we can improve care and improve improve long-term care by making sure that if we're going to have a program, as we do now, it's now called the Special Focus Facility Program, which focuses on the nursing homes. We have about a little more than 15,000 nationwide. There's about 3% of them that consistently have problems or poor performers. But the program to provide special focus on that 3%, and I think it's important to emphasize it's 3%, it's not 90 or 80, but of the 3%, it's a couple hundred facilities, but we've had a program that was only able to cover a portion of the 500 or 600 that are usually on the list. So this would make sure that the resources are there to pay attention to all 500 and not just about 100 of the 500. But we also have to help these long-term care facilities with basic, the basic costs of providing quality care. We can't just throw the book at them and say you're not doing a good job. You're providing poor care. We have to, in my judgment, provide more support. And again, it's an obligation, I think, that we have. And we say that we care about seniors. We say how much we learn from them. These are people that fought our wars. They worked in our factories. They built the greatest middle class we've ever known. They've brought so much love and value to our lives. The least that we can do is to say, no matter who you are, when you reach a certain age and you need skilled care in a nursing home or a long-term care facility, we're going to provide that. The additional challenge here is we don't have enough opportunities for them to get home and community-based care. If most seniors, I think even non-seniors, had a choice between getting care in a residential facility of some kind or at home, I think most would prefer at home. We haven't made that transition yet, mostly because the dollars haven't been there to provide home and community-based services for both for seniors and people with disabilities. We've got about 800,000 Americans on a waiting list to get those kinds of services. So that's a whole other legislative initiative.
Well, we're almost up on time. I'd be remiss if I didn't ask you one more question from the historian's point of view here. You've been in public life through a really disastrous era in American history. September 11, Hurricane Katrina. You've been in the Senate through a number of hurricanes, and not to mention, as you mentioned earlier, climate change, the slow disaster of climate change. And now this pandemic. I don't think you can answer this too briefly, but I might ask you for a first pass at history here. How do you see this pandemic in that broader perspective of these disastrous times it lived in? This was a year of history, and you're in the Senate in this time. I mean, you're part of that history.
Yeah, I was just watching recently on CNN that documentary about the 1918 pandemic, and there were fights then about masks. There were fights then about how much public health, how many public health measures should we fully embrace. So, to a large extent, we didn't learn enough in the 100 years. I sure hope that when the history of this pandemic is fully chronicled, that we learn it well and can implement the lessons that should be learned. But there's no question that public health has to guide your decisions. And to a certain extent, that was the case here, but we didn't, as a people, as a nation, didn't follow public health guidance closely enough. And we didn't invest the dollars and devote the time to developing that public health infrastructure that would provide us with a better, we'd be more fortified against a pandemic. It would also help even now with the advent of the vaccine. I think some of that public health infrastructure would be readily available or translatable, maybe is the right word, to the distribution of the vaccine. So there's a lot to learn, but I'm just mindful that we lost a lot of Americans,
Yeah.
and I think unnecessarily, because of some of the failures at the federal level, and because of some of the politicization of some of these issues. So I hope that if we're confronting a pandemic again, God help us, I hope it's not for decades from now,
Yeah.
that we will have learned something.
Senator Bob Casey, thanks so much for your leadership through a difficult year, and thanks for making time to talk about it today on COVID Calls. Really appreciate it, and good luck in the next Congress. We need you there.
Thanks, Doctor.
Great pleasure to have Senator Bob Casey on COVID Calls today, and going to now read obituaries of a few Pennsylvania residents. Just going to turn to that now. The numbers, as I read earlier at the top of the program before I talked to Senator Casey, were staggering. We're still right around that 4,000 a day mark. And let me put some human perspective to that for our conversation. Was really impressed, I should just say, speaking with Senator Casey, who I know likes to get very much into the legislative weeds on issues like public health and on aging. And I'm impressed that he was eager to go into so much detail on the nursing home reform, because one has to take into account that if we had already brought what he called a justice mindset to not only people who are receiving care, but the caregivers, this pandemic would have looked very different. Let me turn now to obituaries. Headline is: a coroner, Scranton, Pennsylvania firefighter died from COVID-19 pulmonary embolisms. This was published December 31st, 2020 by Jim Lockwood in the Times-Tribune, Scranton. The death of a 28-year-old Scranton firefighter was caused by multiple pulmonary embolisms from COVID-19, Lackawanna County Coroner Tim Rowland announced December 30th. Stephen Sunday, who died December 29th, previously tested positive for the COVID-19 coronavirus and was in quarantine at home when he became critically ill and was hospitalized, Rowland said. A pulmonary embolism is a blockage in one of the pulmonary arteries in the lungs. A firefighter since January of 2020, Sunday died at Geisinger Community Medical Center. As of December 16th, the city said 14 firefighters had tested positive for COVID-19 and another 6 were in quarantine, bringing the number of personnel out to 20 in the department with 135 firefighters. We're starting to see several of those members return to work, Fire Chief John Judge said. In total, 32 fire, police, and public works employees were off work because of positive COVID-19 tests as of December 16th. Updated information on the number of city employees who have tested positive and were out of quarantine was not immediately available. Sunday is the only city employee to have died from COVID-19, City Business Administrator Carl Deely confirmed. Police officers and firefighters began receiving COVID-19 vaccines recently, he added. Remembered by friends and colleagues for his enthusiasm and work ethic, Sunday followed in the footsteps of his maternal grandfather, John P. Lawless, in becoming a city firefighter. A 2010 graduate of West Scranton High School, Sunday was a standout baseball catcher and the first sophomore inducted into the 1,000-pound weightlifting club. He also played for the West Side American Legion baseball team and hit a home run at Doubleday Hall of Fame Field in Cooperstown, New York. Sunday earned an associate's degree in physical education from the Sullivan County Community College in New York and played on 2011 conference title baseball team. He was awarded the 2012 Chancellor's Scholar Athlete Award, one of two given throughout New York State annually and the first at SCCC. An avid Red Sox fan, Sunday then attended St. Thomas Aquinas College in New York, where he played on two championship teams and in the NCAA Division II College World Series. After college, he played in the Independent Frontier Baseball League in Michigan and Kentucky. Sunday then became an emergency medical technician with Commonwealth Health Emergency Medical Services and was a certified deep water scuba diver. A funeral procession led by the Scranton Fire Department traveled to Cathedral Cemetery for interment. Active and retired city firefighters marched in formation to the cemetery. "We will be properly sending off our brother," Chief Judge said. City and fire department requested that any outside agencies refrain from sending delegations, members, or apparatuses because of public health concerns related to COVID-19. Keeping with Pennsylvania obituaries, the headline is Abraham Emanuel Brown, 85, worked as a security guard and loved to garden. This was written by Valerie Russ and was published May 28, 2020 in the Philadelphia Inquirer. Abraham Emanuel Brown excelled at gardening. He knew how to make things grow and thrive, whether it was plants, lawns, or anything nature related, said his granddaughter, Latoya Benz. His flowers were all over his house. He had a special touch that he couldn't explain, but his food tasted better. His callaloo was known to be the sweetest, his granddaughter said. Callaloo is a dark, leafy vegetable that looks like collard greens but has a sweeter taste. People called him the Callaloo Man. Mr. Brown, 85, of the West Oak Lane section of the city, died May 3rd from COVID-19 at the hospital of the University of Pennsylvania. He grew up on a rice farm in St. Catherine, Jamaica, where he was born in 1934, the youngest of 6 children of Solomon and Margaret Graham Brown. Known to his family as Bram, he left school in the 9th grade to work on the farm. In 1962, he married his wife, Rosalind Mayhew Brown. In Jamaica, he worked sunup to sundown, both at his farm and as a supervisor at Linstead Market. Seeking better opportunities, Mr. Brown came to Philadelphia in 1990. He first found work as a laborer and later as a security guard. He and his wife joined the Willow Grove Seventh-day Adventist Church. He helped neighbors with their gardens and cut lawns and shoveled snow without being asked, the family said. And he loved gardening. He also loved gathering his large family of 7 children together for prayers and to treat them to his legendary storytelling. He always wanted us to go above where he was in life, said daughter Elaine. He pushed us to go to school. Benz said Mr. Brown also loved dressing well. He liked things of a good quality in clothing, shoes, furniture, and good leather. Sometimes he would buy name brands and not know what they meant. He just saw their quality, she said. In addition to his wife, daughter, and granddaughter, Mr. Brown is survived by daughters Yvonne, Norma, and Marceline, sons Hector, Hopeton, and Dwight, 8 other grandchildren, 3 great-grandchildren, and many other relatives. A private service was held on Wednesday, May 20th. The headline is Newcastle Couple Loses Battle Against COVID-19. Betty and Dave Kastick died days apart following COVID-19 diagnosis. This was published April 19th, 2020. It was reported by Caitlin Sykes. Dateline is Newcastle, Pennsylvania. A Newcastle family is heartbroken after losing a couple to COVID-19. Betty and Dave Kastick were living out their dream and traveling the country by RV. It was always her dream to get an RV and travel, said Kristen Esposito, Betty's granddaughter. Esposito said the pair retired in 2019 and bought the RV in September. They hit the road immediately, stopping in Maine in October, then the Florida Keys. She said Betty always wanted to go to Mardi Gras, so the couple arrived in Louisiana in January. When they went to Mardi Gras, the coronavirus wasn't as big of a deal at that point, she said. The pair returned home on March 21st and days later became ill. On the 26th, she started getting a fever, she said. She just was kind of achy and had a fever. She didn't have a cough. Her throat didn't hurt. No other symptoms except a fever. She thought, maybe I'm just getting a virus or an infection. She wasn't too worried. The hospital told Betty to get tested for the coronavirus on the 30th of March. She woke up on the 31st very ill, she said. Her fever was over 102, very, very achy, just completely miserable. So that's when my mom took her to the hospital for the second time, and they admitted her and induced her into a coma that night. On April 1st, Dave was hospitalized and placed on a ventilator. Once it hit them, it just went so fast that it just overtook their body, she said. Dave passed away on April 9th, and Betty died on April 14th. Esposito said Betty didn't even know her husband had died. She was just such an amazing person, she said. She would do anything for anybody. She was just so feisty. She was such a special person. Esposito said she's not sure where her grandmother contracted the virus, but had left Mardi Gras before officials shut it down. They could have got it and just carried it, and it took a little while for her to get the symptoms, but I can't say. I wish they didn't go because that's what she wanted, and she got to experience. She got to experience it with her husband, and my mom went with them. She says it's important for people to take this virus seriously because it can happen to anyone. All they're asking is for us to stay home, wear a mask, and wash our hands, she said. It's simple. And yet, when this is all over, everybody is going to go back to their normal lives. But I lost my grandma. My life will never be the same because I lost my best friend to this. I want to remind everybody that you can catch COVID calls live every weekday, 5 p.m. Eastern Time. And I want to once again thank my guest today, Pennsylvania Senator Bob Casey, for joining me on one of my special congressional COVID calls. And we're going to continue with that tomorrow. I have House Representative Jake Auchincloss, representative of the Massachusetts 4th District tomorrow. And he was just recently sworn in, first term member of the House of Representatives from Massachusetts. We'll be really looking forward to speaking with him. Thank you all for joining me today. Stay healthy. We'll see you tomorrow, 5 o'clock.